Good day, ma'am. My name is Erika, Leianne, and Andiano, and today I'm going to recite the procedure in starting the IV infusion. First is verify the IV solution order on the MAR or CMAR with the medical order to ensure right medication will be administered. Then, next is check for color, leaking, and expiration date of the IV solution. Then know the techniques, precaution, purpose, and medication order. Then gather all the equipments and bring to the bedside. It is to save time. Then perform hand hygiene and put on PPE if indicated. Then identify the patient to ensure that it is the right patient. Then close curtains around the bed and close the door to the room. If possible, it is to provide privacy to the patient. Then explain the procedure to the patient. In explaining the procedure, you have to ask. You have to say what you are going to do and why you are going to do it. Ask the patient about allergies. It is to facilitate his or her cooperation. In preparing the IV solution and administration set, compare the IV container label with the MAR to ensure right solution will be administered. Then check for the expiration date to avoid any errors. Then label the solution container with the patient's name, solution type, additives, date and time for easy and accurate monitoring. Then removes administration set from package. Then maintain aseptic technique. Then apply label to tubing reflecting the day or date for next set change. Usually the next set change will be within 72 to 96 hours. Then next is close the roller clamp or slide clamp to prevent air or fluid from entering the IV solution. Then inverts the IV solution container and removes the cup on the entry site. Do not touch the exposed entry site to prevent any contamination. Then removes the cup from the spike on the administration set. This will allow to access on the container. Then using a twisting and pushing motion, insert the administration set spike. Then hang the IV container on the IV pole so that the fluid will move into the drip chamber. Then squeeze the drip chamber and fill it at least halfway so the air will not flow down to IV tubing. Then open the IV tubing clamp and allows fluid to move through tubing. Then make sure to remove bubbles because bubbles it can act as an embolus. Then after that, close the clamp and maintaining its sterility. After fluid has filled the tubing, recaps the end of the tubing. Then in initiating peripheral venous access, place the patient in low Fowler's position and place protective towel or pad under the patient's arm. It is to prevent any blood contamination to the surface of the bed. Then provide emotional support as needed because the patient may experience anxiety. Then select and palpate for an appropriate vein. This will prevent the risk of damaging the body tissue. Then if the site is hairy, clips a 2-inch area around the intended site of entry because hair can harbor microorganisms and inhibit adhesion of site dressing. Then next is put on gloves to prevent contact with blood and body fluids. Then applies a tourniquet 3 to 4 inches above the venipuncture site to obstruct venous blood flow and distend the vein. Then make sure that the radial pulse is still present. Then instruct the patient to hold the arm lower than the heart. This is to distend the vein. Then ask the patient to open it and Open and close the fist. This forces the blood into the vein. Then observe and palpate for suitable vein. Then after that, if a vein cannot be felt, there are two options. Um, Massage the patient's arm from proximal to distal end and gently tap the intended vein. Then the second option is you have to remove the tourniquet and place warm or moist compress over intended vein for at least 10 to 15 minutes. Then cleanse site with an antiseptic solution or chlorhexidine using back and forth friction scrub for at least 30 seconds. Do not wipe or blot. Allow it to dry completely. Then chlorhexidine is preferred antiseptic solution. Then um, use the non-dominant hand to hold the skin taut against the vein. Place about 1 or 2 inches below the entry side. Avoid touching the prepared side and ask the patient to remain still. Then enter the skin gently, holding the catheter by the hub in dominant hand, and then bevel side up at 10 to 15-degree angle. Then insert the catheter directly to the vein or from the side of the vein. While following the course of the vein, advance the needle or the catheter into the vein. Then next is when blood return through the lumen of the needle or the flashback chamber of the catheter, advance into the vein until the hub is at the venipuncture site. Then release the tourniquet. Then stabilize the catheter with non-dominant hand. Then um, remove the protective cup from the tubing and attach it to the catheter. Do not touch the entry of connection. Then secure the protection. Then begin a primary infusion by slowly opening slide clamp or adjusting the roller clamp of the tubing. Inspect the site for sign of infiltration. For sign of infiltration and leaking. If it happens, it means it is unsuccessful and you have to discontinue. Then open and apply the skin protectant to the site. Make sure to cover the area to be covered with dressing. Then place sterile transparent dressing over the venipuncture site to allow easy visualization to the site. Then loops the tubing near the entry site and anchor it with tape. Then anchor it with tape close to the site because the weight of the tube is sufficient to pull it out of the vein. Then if infusing by gravity drip, adjust flow rate to correct drops. Then drops per minute. Adjust until the correct drop rate is achieved. Then next is label the IV dressing with the date, time, site, and size of catheter used for the infusion. Then apply an IV securement or stabilization device based on the facility policy. Explain to the patient the purpose of the device and the importance of safeguarding the site when using the extremity. Then next is removes equipment and return the patient to a comfortable position or lower the bed. This Then next is use stylet or other sharp in appropriate sharp container and discard supplies. It is to reduce the infection transmission. Then remove gloves and PPE if used and perform the hand hygiene. Then document appropriate information on the patient chart. Then last is return to check flow rate and observe IV site for infiltration 30 minutes after starting the infusion. Then ask the patient if he or she is experiencing any pain or discomfort related to the IV infusion.